So we're doing instrument-assisted soft tissue mobilization using the MPT tool. And this is rotator cuff tear and repair. And we are about 6 weeks post-op. And as you can see, this surgical line is very, very thin and completely closed. But there is, some adhesion following the surgery, and also a little bit of scar tissue, especially where the incision line is. Again, it's very thin. It's just very thin, very small, but you can make it out a little bit. So I'm going to go in slowly now. So we're going to do the treatment on the entire area. We're going to bring in some of the pectoralis major muscle. We're going to bring in definitely the deltoid. We're going to bring in rotator cuff, supraspinatus, infraspinatus. So we're going to be hitting this entire area. So I'm going to start off slowly in the front, more toward the long head of the biceps. And again, as I'm doing this treatment, as I'm starting, I'm going in slowly and not with a lot of pressure. I want to ease into the treatment, and as I go along, I'll actually be able to, as the tissue loosens up, I'll be able to get in deeper, just because the tissue's allowing me to do that. Okay, so I'm starting off slowly. I'm also, as I'm going, I'm trying to detect where the excess tissue adhesion and scar tissue buildup is. And right now I'm feeling, so that indication to me is that granular or bumpy sensation. And I'm feeling it more down here, the distal end of the deltoid muscle. So I'm feeling a lot there. I'm going to put a little bit more ointment on there. This is actually gel. I'm going to put a little bit more gel on it. And since it's a smaller area, I'm going to use the smaller radius. Here's the smaller radius. This is the larger radius. But I'm going to use the small radius, and I'm probably going to use the edge here too, the straight edge. So I'll come in here, and this cadence or tool speed is about what I want. Again, so I'm trying to do a number of things. We're trying to mechanically move the inflammation, decrease the inflammation through mechanical mobilization, also stimulating the lymphatic system. We're also wanting to, at the same time, increase blood flow to the area to further aid in healing the tissue. Again, the third thing is to break down or break up excess adhesion, tissue adhesion or scar tissue buildup, which is normal, following injury and or surgery. So we had both here. We had a rotator cuff tear and then rotator cuff repair. So I am feeling a lot of this granular sensation down here, more at the biceps area, and also the distal portion of the deltoid. So I'm going to get in here now. I'm going to come off that area. I'm going to come back to it, but I want to make sure that during the treatment I'm hitting all of the areas of the shoulder. So anterior in this region, come off here, more lateral, right off the AC joint here, acromioclavicular joint. I want to feel that and see how that feels. Again, using the radius, this smaller radius. Have my thumbs here. I'm doing this type of a motion with the tool, kind of forward and backwards type motion, and I'm getting in with the edge as I'm doing it. So I'm really able to reach the entire shoulder girdle as I'm treating. I'm going to come back to the anterior portion here. Again, I do feel some of that granular sensation anteriorly, right along the biceps tendon. Okay, now I'll go back over here and I'll use the straight edge. And I can use the straight edge coming down on the back of the deltoid. I can use the straight edge over here, getting the infraspinatus. And with the shoulder, really, I can use both. I can either use the straight edge or I can use the radius. And as you see, I'm holding it with one hand, but I can easily, hold it with two hands. If I need more leverage, if I need to generate a little bit more force. But again, this tool is really doing almost all of the work for me. Very little pressure is being applied by my fingers or thumb. I'm just guiding it. I'm just guiding the tool, with my hand, fingers, and arm. And really the tool is doing all of the work, especially because of the weight of the tool factors in. It's light enough to hold, but it's heavy enough where the tool weight, which is about a pound, gets right into the tissue layers. And again, the tissue layers would be initially the skin, and then underneath that, the fascia, and then getting deeper into the muscle tissue. And, we can even, depending on what area of the body, we can even affect the tendons. If we can get down into even deeper tissue layers. This is more of a circular motion now I'm applying with the radius side. And I'm keeping an eye on the skin as well. I'm making sure that I'm not seeing any skin breakdown as I'm going along, and everything looks fine. I'm making sure that there's no discoloration in terms of like a deep reddened color. I'm not seeing that. You're gonna see a little bit of pink or bright red, and that's indicative of an increase in blood flow to the area, which is what we want. Okay. Again, coming back here to the supraspinatus, infraspinatus region. Also, get up here into the trap region. Just making sure we get all of the muscles around the shoulder girdle. All right. And as I'm going along, especially anteriorly, I'm not feeling as much of that granular or bumpy sensation. And again, that's indicative of breaking up some of that adhesion and excess scar tissue that has built up over time. Okay. And again, this is a good precursor to other things that I'm going to be doing with this patient, including range of motion exercises, resistive exercises. So this is a good treatment application that goes along with other forms of treatment that I'll be carrying out with this client.